Good afternoon and welcome to the second annual general meeting of NHS Humber and North Yorkshire Integrated Care Board. I'm Sue Symington, Chair of the Board, and I'm delighted to welcome you. First, let me thank you for taking time to watch our AGM. We've taken the unusual step of pre-recording our AGM in a film format this year. Our AGM is the cornerstone of our responsibility to be accountable to those we serve, and in delivering our AGM in this format hopefully improves the quality of our communication and increases our accessibility to the public, to our stakeholders and to our staff. Finding ways to engage with the public and encouraging participation is vital for an integrated care system, which is why from April this year we've taken the step to hold routine board meetings in public every month instead of every 2 months. These meetings are live streamed and recordings, agendas and board papers are all published on our website. By making this change, we aim to increasingly engage the public in the development and improvement of health services, and providing frequent updates on the work of the board is part of this. If you haven't yet had a go at observing a board meeting, I encourage you to do so. Our AGM provides us with a further opportunity to engage with our population by asking you for your questions to be submitted in advance of the AGM. These questions will all be published with the answers on our website following this meeting, and a link will be provided. I am aware that some members of the public would prefer us to hold our meetings in public, allowing the public to observe our work in person. We keep this under review. Humber and North Yorkshire is a large geography covering 1,500 square miles. It's impossible to find a single place which is easy to reach for the whole population. So in the interest of accessibility, we've chosen to live stream our meetings, hopefully enabling the greatest number of interested people to access our work. As technology develops, this becomes an increasingly practical way of engaging with those we serve. As I said, we'll keep this under review. The AGM, supported by our annual report, is a platform to reflect on the performance and achievements of the past year, while also setting out our vision for addressing the challenges facing health and care, both in the coming year and years ahead. The progress we share today reflects our entire system across our 6 places, including North East Lincolnshire, North Lincolnshire, North Yorkshire, York, Hull and the East Riding. It reflects the work of many partners, including 6 local authorities, 4 acute hospital trusts, 3 mental health trusts, 181 GP practices, dental practices and 2 ambulance trusts, along with thousands of volunteers. More than 50,000 people are involved in the delivery of health services across our geography. This makes us one of the largest integrated care systems in England. While this Integrated Care Board is accountable for NHS spend and performance, and our Integrated Care Partnership oversees the delivery of our strategy, it's the system as a collective who are responsible ultimately for delivering our strategy. Despite having a budget of around 3.5 billion and more than 50,000 people, the key to our successes is and will be the partnerships which exist across this extensive geography. Partners who share a deep commitment to making changes that can deliver an improved, joined up, safe, quality health and social care system for our population. In May 2023, we published our first system strategy. This document sets out our ambition for everyone in our population to live longer, healthier lives. We're focused on narrowing the gap in healthy life expectancy between those from deprived communities and those from more affluent areas, where life expectancy can vary by up to 10 years. And alongside this, we aim to increase the overall healthy life expectancy of our whole population by 5 years by 2035. To reach this ambitious goal, we have widely understood and recognised vision around which the whole system can focus. It follows a life course pattern: start well, live well, age well and die well. By start well, we mean that we want every child to have the best start in life, enabling every child to be safe, to grow and to learn. By live well, we mean that we want to ensure that the next generation are healthier than the last and have the opportunity to thrive in all areas of their life. By age well, we mean that we want to ensure people live healthy lives for as long as possible by understanding what matters most to them. And by die well, we mean that we want to create an environment in which we can have positive conversations about death and dying. In the years ahead, this simple vision will continue to drive the work of our integrated care system. Our strength lies in our commitment to delivering this vision, the strength of our partnerships and the skill of our people. We're shortly going to share a short film that outlines some of the stark population health challenges we face across Humber and North Yorkshire and the importance of maintaining good health. This film will reinforce the need and importance of our system working together to achieve our start well, live well, age well, die well vision. After this film, our Chief Executive Stephen Eames will provide an outline of some key achievements from the year 23-24, and this will be followed by another short film to give more detail on a couple of these achievements. We'll then hear from Dr. Nigel Wells, our Director of Clinical and Professional Services, who will provide a clinical and quality update, followed by Jane Hazelgrave, our Director of Finance and Investment, who will talk about our spend and performance from the year. Thank you for joining us today. By working together, we will make a significant difference to the health and well-being of our population. I know that you'll find the content of this AGM most interesting. Thank you.
Why is it put healthy? I think for me, it's about having that quality of life.
I feel like health sort of comes before everything else. You can't really enjoy anything if you're unhealthy while doing it.
If you haven't got health, there is nothing you can do. You can go about your daily activities.
There's less strain on services if everyone's healthier. Everyone's happier when you're healthier.
As you get older, you really appreciate the validity of good health.
I'd like to live long enough to see my daughter grown up and grandchildren.
I would like to stay fit and active and doing the things I enjoy doing until I'm well into my 80s.
One of the biggest priorities that people should have is looking after their own health.
I think I'm aware of what to do. I know what to do. The problem is putting it into practice.
I think my problem is eating too much sugar, so I need to cut down on sugary things. It's a bit like a drug. You're addicted to it, so it's hard to stop.
It's just cooking when I've got a newborn baby. Order takeaway, it's just easy and fast.
I feel like it's more expensive to get healthier foods at the minute.
Well, I'm overweight, and where you're moving about, you can tell. And so to be able to lose that weight would be better for me.
I work too much and I'm at uni, so I don't have time to go to the gym, and a membership isn't really something that you can afford when you're working part-time as well.
I used to do a lot of karate, but I haven't done that for a long time because I do long shifts, so I can't get.
Definitely because we're at uni, I think drinking is one of the big things to maybe start to reduce a little bit more.
I don't smoke or vape. My mum, I'll be honest, I did it for 2 weeks. My mum found it and she went, you either give it up or I won't pay for your gym.
Why is it difficult to stop?
It's very addictive when it's socially acceptable and my friends smoke and sort of fitting in.
I've given up smoking on and off, substitute it with vaping, which now is even worse because it's on hand all the time.
Suffering with what I go through on a daily basis, I've piled on pounds, especially been told no so many times with looking for a job. It's just knocked my confidence, made my self-esteem about myself even worse. I just feel like it makes me feel like I'm not good enough. It makes me feel like I've been cursed to live on this world and never to get a job just because I'm disabled.
My diet's changed because I'm diabetic as well, so I've reduced sugar on everything. Stopped smoking. What has changed? Well, I can go upstairs now, which I couldn't before.
Yeah, I've got arthritis in my spine, in lots of other joints. I've just had to have a new hip done. And it's just a matter of keep walking, keep yourself moving all the time, go swimming, and keep your mind occupied as well.
Well, I do a lot of walking regularly, every day. I walk twice a day, sort of 20 minutes in the morning, 40 minutes at the evening.
Well, my partner, he was smoking, he had a heart attack, and I was still carrying on smoking. I thought, well, I'm going to try and stop, because I was smoking a lot. And I watched my sister die at 51 with lung cancer, and you won't let a dog die like that, so I thought, I'm going to do it.
I've started eating healthily. Stop eating processed food. I try, watch how much beer I take.
I have endometriosis, so I've been trying to sort of do things to help that, which has been lifestyle changes. I drink like oat milk or almond milk, things like that. I try to eat a lot less meat, just choosing like healthier meals.
I wouldn't do anything, I would just sit around the house, just play my PS4, that's like legit it. And now I do urban exploring, get myself out of the house, keep myself in shape.
I'm just on my way from the gym, so I try to work out regularly.
I am part of a sea swimming group in Scarborough, and I'm a part of the rambling group, Scarborough Rambling Club. So every week, Sunday, we do like 10 to 12 miles.
When I was a lot younger, I was really overweight. So when I was 13, I was about 13 stone. I just cut down on food and started exercising more.
You only get one chance at life, and you've got to make it as the best you can.
Hello, I'm Stephen Eames. I'm Chief Executive for Humber and North Yorkshire Integrated Care Board. I'm going to run through a few of the key highlights and achievements during the last 12 months or so. As Sue mentioned earlier, although the Integrated Care Board is responsible and accountable for NHS spend and performance, our success is entirely dependent on our work with partners across our health and care system. Those partners in local government, in the voluntary sector, out in the community. So all these achievements I'm talking about are with them as well. We've invested a lot in our emergency care services. We've opened a number of new urgent emergency facilities and departments right across Humber and North Yorkshire in the last 12 months. These are more modern, better equipped facilities, purpose-built to meet the needs of our patients and our communities for years to come. In January 24, following a £4.4 million investment, same-day emergency care and integrated acute assessment units opened at the Diana, Princess of Wales Hospital in Grimsby. York Hospital's £18 million expanded and redesigned emergency department was officially opened in July 2023. This is a big expansion which took 20 months to complete and includes a vital new 8-bedded resuscitation area and 12 new assessment and treatment cubicles. It's anticipated to open fully in 2024. Work is now underway to complete a new £47 million urgent and emergency care centre at Scarborough Hospital. Hull Story Street walk-in service has also moved to a new home at Hull Royal Infirmary, leading to improved integration of urgent care services in the city. This move aims to ease pressures on the emergency department at the hospital by reducing overcrowding, inappropriate attendances and patient waiting times. We've also introduced a range of community diagnostic centres. GPs can refer patients to a centre so they can access life-saving checks closer to home and be diagnosed for a range of conditions rather than travelling to hospital. These centres enable an increase in diagnostic capacity, which we hope will reduce waiting list times and improve access for our patients. The community diagnostic centres are now open in Ripon, East Riding, Selby and York. Building work has started in Scunthorpe and Grimsby. Construction will also begin shortly for the centre in Hull's Albion Square on a new 18 million NHS facility which will welcome thousands of patients annually. We've continued to focus on improving access to primary care, making sure that patients in our communities get swift access to see a GP. Our primary care improvement plan has been developed by all 43 primary care networks across Humber and North Yorkshire. As part of these plans, we're supporting GP practices to move to cloud-based telephony systems. This will create a better experience for patients who will no longer hear an engaged tone, but will be presented with an options menu and a queuing system and an opportunity for recorded messages. It will also support GP practices by providing them with real-time data to inform the way in which they organise to make sure that they can see more patients. The plans have also seen progress being made with primary care networks improving accessibility for website and online tools, including promotion of the National Health Service app and the 111 call line. Other elements include care navigation, training, promotion of community pharmacy services, enabling capacity in the wider general practice team, and increasing self-referrals where that's appropriate. We have been addressing the long waits for secondary care, working collaboratively. The 4 acute hospitals in Humber and North Yorkshire have made significant progress on addressing these waiting times during the last 12 months, with 99.7% of patients seen within the national requirement of 65 weeks. This means thousands more patients within our region are being seen much more quickly. As an example of this collaboration, over 200 patients transferred from one trust to another, meaning their treatment was offered much more quickly. In addition, a patient engagement portal has also been developed across all 4 hospitals to assist in two-way communication between the hospital and the patient. This allows the patient and the hospital to communicate much more easily and provides quicker access to clinical information, which is of high value to our patients. In this last year, we took on responsibility for dental commissioning. In our first year as dental commissioners, we focused on stabilising the system, building relationships, and maximising the use of the NHS dental budget. A position was taken very early on to deliver the expected activity below our contracted levels, and this allowed us to reinvest in priority areas at the beginning of the year. This funding was then used to secure additional urgent access sessions, vitally important, particularly for our children, and providing practices with more funding to make weekly sessions available for patients with an urgent dental need. We've also been improving outcomes for cancer diagnosis. Our Cancer Champions programme has now trained over 5,000 people, with sessions this year also being delivered to our main target groups, including our Eastern European community, Muslim faith groups, and people with a learning disability. Our NHS targeted lung health checks have been launched in the East Riding of Yorkshire. This means this is now available all across our area in Humber and North Yorkshire. These checks can help to identify lung cancer and other respiratory diseases early, which is vital to do. And this is often before symptoms have occurred and when treatment could be simpler and much more successful. We'd now like to share with you a couple of short films about 2 of our centres of excellence for tobacco control and for care of the elderly frail. Our Tobacco Control Centre of Excellence is a groundbreaking regional programme dedicated to reducing the harm from tobacco. Tobacco and smoking-related diseases remains the biggest killer across our area. The aim of the centre is to unite partners across Humber and North Yorkshire to create a future free from tobacco harm by collaborating, coordinating, innovating and amplifying initiatives to end smoking. We've made treatment tobacco dependency a top priority and have also accelerated implementation of the long-term plan, national long-term plan for tobacco control, where specialised swap and stop tobacco dependency treatment services have been integrated into our day-to-day hospital services. The second film will cover frailty. In Hull in East Yorkshire, the Jean Bishop Integrated Care Centre has been transformative for the lives of many elderly people. It's the first of its kind in the UK and is internationally recognised. Patients who are referred to the centre receive a bespoke care plan following same-day appointments with a range of health and social care professionals. This whole person approach to the health and care of elderly people works with reduced emergency hospital admissions for patients over 80 and those in care homes. Its success is why we are creating this Centre of Excellence for Frailty across Humber and North Yorkshire, using this fantastic example and way of working for everyone who lives in our area, and to build on what we've learned from the Jean Bishop Integrated Care Centre, sharing all the clinical expertise and best practice throughout our wider area. So I'm delighted to be here today to launch the Centre of Excellence across our region in Humber and North Yorkshire, stretching from Harrogate all the way down to North Lincolnshire. I'm here at the Jean Bishop Integrated Care Centre, and we're building our Centre of Excellence on the back of 6 years of really hard, innovative, dynamic work.
Our health is about a lot of things: where we happen to be born, what our education happens to be like, how good our parents manage to be. All these things impact our health. And there's recognition that those things don't all fall within the remit of the NHS. So how do we enable babies and children to start well in their lives? How do we then go on and live well during the course of our lives? What can we do to make sure that the ageing process enables us to live well and independently? How do we ensure that when end of life comes, it's the best death that can be managed? Again, potentially closer to home, with care that's wrapped around you at home rather than you finding yourself in a hospital. We're also concerned about the difference in healthy life expectancy. So in more deprived areas, we see people become more frail and begin to suffer with ill health in their mid-50s, where in a more prosperous area, that process might not begin till someone's in their 70s. And one of the absolute objectives of our integrated care system is to balance that out. And those are our ambitions, that we level out this difference in life expectancy and we level out this difference in healthy life expectancy.
So it's all around identifying people living with frailty, knowing what their wishes are, which generally is around independence and well-being, but really understanding, our needs of our frail population and how we can support them better.
It's about how we join all this up as a system, not automatically send everybody to hospital. We've got the evidence base to say it's not just the right thing to do economically, but from a patient perspective and their family's perspective as well.
But what we really want to be as a system is in a place where we're expanding those healthy life years of an individual as they age. So their time spent living with severe frailty is decreased, but their healthy time is increased.
So this model of anticipating illness before it happens, preventing illness, caring for people in a way that enables them to stay at home is absolutely the preferable way.
I'm used to doing everything myself, but things have got more difficult now. It takes longer and it gets more difficult to do things, Yeah, you name it, I've got it.
Somebody might, have a fall. We can look at, how can we try and prevent future falls, but also support them still to potentially stay at home if that's what they want, or have short periods of rehabilitation again, but trying to support them getting back to being as independent and well as possible.
But he is getting to the point where we just need sort of like a little bit more help. So that's why we've sort of like accessed the Jean Bishop Centre to keep him in his own home, really, sort of like for as long as we possibly can. His mobility is getting progressively worse. They've given him a frame with skis on and all that sort of stuff and everything. They've just been absolutely fabulous.
What's really heartening, I think, is that everybody seems to have left their organisational hat at the door, and they're coming together to do this because it's the right thing to do.
We're actually just one team working together, providing that seamless care for patients with frailty through both anticipatory care, crisis response, and getting them out of hospital. And then what do we need to do to wrap services around them once they come out of hospital to try and prevent them from going back in again?
So it's taking all the ideas, innovations that are working in these different places to improve outcomes and improve the care of people with frailty, bringing those leads together to be able to understand what's working well, what could we do differently, how can we learn from one another, share that best practice and ultimately improve outcomes.
If you have frailty and you live with frailty, we can offer the same response irrespective of where you live across the board.
They get to see one doctor who understands and knows their case, who can manage all the elements of their condition. So it's a really, really efficient way of treating patients, but it's also much more user-friendly. So much easier to come to one place and have all your needs met than find yourself with multiple appointments going to different places.
It's good, yeah. I'll give them top marks for that. They've sort of got charm for you, and they don't choke over you like a lot of medical people do with long words and things. They say it as it is,
The communication between themselves and me is absolutely amazing. They're just, top notch. Can't fault it.
Everything these people have promised, they've done. Can't fault them.
My name's Scott Crosby. I'm the Associate Director for the Centre for Excellence in Tobacco Control in the Humber and North Yorkshire ICB. I lead a small team of experts, and we work with our partners, sort of gelling our partners together to reduce smoking rates further and faster than anywhere else. We have smoking rates of around 13%. That's around 185,000 smokers we have in Humber and North Yorkshire. And that's not equally distributed in terms of across the patch. So for example, in Hull, around 18% of the population in Hull smoke, and around 7% of York. And then there are pockets of smokers as well. So it's our job to lead the system to be able to end smoking everywhere in Humber and North Yorkshire. So not only will we be working with our partners and all of our partners across Humber and North Yorkshire, we will also need to have national action if we are to achieve our ambitions. And they may seem ambitious, but they are achievable. We know that from evidence of working together and academic evidence across the world. If we work together, we can reduce smoking prevalence. We have two main strands of work in Humber, North Yorkshire. The first one is helping smokers to quit. It's really important that we help smokers to quit. It's not easy, it's addiction, and then it's an addiction that starts in childhood. So many smokers have been smoking for many years, and we have to help smokers to quit. The best way to help smokers to quit is to provide medication and at the same time provide professional support. So we will be doing our best to provide that support for as many smokers as we can. The second strand is around helping people never to start smoking. And unfortunately, most people who start smoking do so in childhood. Smoking is a childhood addiction. It's a childhood addiction that generally starts around between the age of 10 and 18. Most people are hooked by that time and then really find it difficult. And around 2/3 of people who don't quit will die because of their addiction. So it's really important that we get young people in particular never to start smoking, which is why we will always push for further legislation and increasing the price and reducing the illicit tobacco, for example, in Humber, North Yorkshire, to make sure that tobacco is always out of reach from our young people. So we work to 4 principles. First of all, we've got collaboration, and it's really important that we work with our partners across Humber, North Yorkshire, working with our directors of public health and their public health teams, working with primary care and GPs, working with our hospital trusts and all the hospitals, as well as academics, and also as well as our charitable and voluntary sector as well.
Tobacco is the single greatest cause of health inequalities across Humber and North Yorkshire. It accounts for half the difference in life expectancy and healthy life expectancy in Hull. The Centre of Excellence for Tobacco Control has been built on many years of passionate commitment to reduce the harm and the grip that tobacco has on our communities. I'm really proud to be part of the Humber and North Yorkshire Integrated Care System, a system that has embraced that commitment to reducing tobacco harm and developed the Centre of Excellence. The Centre of Excellence will help us to come together even more strongly as a partnership. The investment that the Integrated Care System has made, both in capacity and in resources, means that we can do more work coordinating across the health system for prevention, intervention, and importantly for the lobbying and for policy decisions to be made that will reduce harm from tobacco overall. This is our time. It's our time as Humber and North Yorkshire to be really strong and maintain that commitment to reducing tobacco harm for our children and young people and for the generations of the future. And I think we can really make a difference by pulling together on this.
So it's our job to coordinate, and there is a lot to coordinate, and for example what we do is make sure that we have hospital specialist advisors, so when someone comes into an inpatient there or from a maternity point of view and in mental health settings, that we offer everybody that comes into our hospitals a chance to quit and give them the best way of quitting.
I'm Phil Truby. I'm a public health specialist at City of York Council, and I've been working with the Tobacco Control Centre for Excellence since its inception. It's a really great collaboration across the 6 places within Humber and North Yorkshire, and it gives us a really good opportunity to learn from each other, from our colleagues in the different local authorities and different ICB place teams. The centre has really helped us develop a strong and cohesive understanding of tobacco control agendas and our programmes of work, and with the sort of continued investment from central government, I'm confident that we will be able to eradicate the harms related to tobacco control.
And then we've got amplification. We have to amplify our message. We have to get our message out there, and we will do that on behalf of the Humber North Yorkshire. For example, we'll need national legislation to push towards our targets, and we're very vocal in our efforts to push for legislation on the tobacco and nicotine bill, looking at increasing the age of sale, increasing packet inserts into packs, and also pushing for further mass media campaigns as well.
smoking is definitely extremely harmful, and I think that no one can really deny that. So
just reducing the amount of deaths, the amount of diseases, things like that. Like I said, I've been personally affected in my family with cancer and stuff, and I think that smoking has contributed towards that. So anything to make everyone healthier.
No damage from smoking. Well, it would be great, wouldn't it?
I think it's a good thing. I think that children should be protected in particular. They're not aware of the harmfulness in regards to tobacco or any other substance abuse. So I think it's a good point to start with.
Yeah, I think really good. It's important that there's the right policy to remove smoking from all areas of society. I think it's a good thing. Yeah.
I think it should be normalised of how awful the effects of it can be. So I definitely support it, 100%.
Yeah, 100% support it. Same what she said, yeah. There's certain things you wouldn't do in life. And if you get into that zone and make it unavailable, then it just becomes undesirable. And I think that's the thing, is you need to make it undesirable.
Yeah, absolutely. I think we often, you know about how we feel about smoking, and we don't smoke. And at school, be encouraged not to smoke as well. So I think generally you know about it's bad for you, isn't it? Yeah.
We've watched it on our telly, and children get into it, and then they start buying it, and then it's really bad for them. And then same as my sister, yeah.
And then lastly, we've got innovation. And it's really important that we innovate with the evidence. And we're looking to do that with the latest state-of-the-art behavioural psychology and behavioural science in our communications and in our marketing campaigns to motivate smokers to quit.
When I was diagnosed, I believe I was diagnosed with stage 4 COPD. I was told I had the lungs of a 96-year-old, and I was 38. At 38, I had a son. So by the time he was 2, I couldn't take him to the park or anything. I was quite ill with it, and I could barely walk because of the breathing and things. So again, I stopped again because I didn't want to be that mum that couldn't take a child to the park and things. I would never want any of my family to go through this COPD that I have, which if I'd have carried on smoking, I probably wouldn't have even been sat here now telling the tale about it. A lot of people as well, when they do get told some bad news about the health, they think then it's too late, like, oh, well, I've already got COPD, so I'll carry on smoking. But, it's never too late. It's never too late to stop. And, yeah, and I'm living proof, basically.
So there is positive news. We are at a record low in smoking prevalence. So we're going in the right direction, but we mustn't take it for granted. So for example, over the last 20 years, we've reduced smoking prevalence by about half, from around 35–36%, and now we're at 13%. That's a lot of lives saved, but it's still the biggest preventable cause of ill health and death. So we must do more to drive smoking rates down further, so we can end smoking everywhere for everyone.
Hello, my name's Nigel Wells, and as you can see, I'm a GP and I'm in my practice in Selby and Beechtree. And I'm the Executive Director of Clinical and Care Professional for the Integrated Care Board. And in other Integrated Care Boards, we talk about me being a medical director. But as I've probably told you before, it's important that our clinical leadership is wider than just doctors. And that's what we're seeing as we've looked back on this year of 23-24 about how we've been able to involve and engage more clinical leaders across our system, which is really, really great news for us. It's been a challenging year as we look back this year, and there's a number of things that have had national impacts as well as regional and local impacts, and I'm sure you're all aware of those. well, I can sort of name a few. The top ones for us would be around the pressures about urgent and emergency care, whether that's in GP surgeries like this or into A&E and UTC areas. And there is a lot of work that we're doing on that area about how we streamline our services and make sure that you get the best access that you can. We know nationally there's been issues with maternity services, and again, that's something that we are closely looking at and putting in improvement methods into our units and across our system to make sure that we drive best practice wherever we can. I must also mention that this year and previously there's been a lot of discussions and focus on the infected blood inquiry, and that's something that's come through this year as well, and that's something I just wanted to acknowledge and also to apologise to anybody who's been affected by these issues. So as we look forward now, as we go forward, what are we going to see and what have we learned from this last year? One of the things that we know by coming together as a system is that we work better together. We share our understandings of what's gone right and what's gone wrong, and we can start to put in new structures and systems for the future. And we've seen that with our governance around mortality and safety. We've seen that about our improvement work that we're putting in through maternity hospitals and maternity units, and also through falls and frailty. And I know that there are a couple of films on this meeting around frailty and the Jean Bishop Centre and the Centre of Excellence on that. And what we want to do is build on that great work and push that across all of our places. Clinical effectiveness is a thing that we're really, or clinical effectiveness is a term or a definition that we're really honing down on in 23-24, but pushing on further into the future, because it means that we reduce the variation in treatment that people get, and we make sure that people are getting best practice in all settings. And from 6 CCGs to 1 ICB has meant that we've needed to bring a lot of policies and pathways together, and we're doing that by bringing clinical colleagues together to look at how we can work better together on those policies and pathways so that everybody gets equitable access to those. And of course, that's really, really important in our geography. We've got strips of the coast that have had difficulties with that in the past, and we've got big areas of rurality and deprivation. And as you know, what's going to happen over the next 10 or 20 years is a large number of our residents being older and in the over 75. So we need to start to look at how our systems and services evolve for that in the future. And clinical leadership, clinical effectiveness is going to be key in that as well. Another couple of things that we've highlighted this year are migrant health and how we really look at that as a system and make sure that we've wrapped around the correct services for our new residents that have come into our area. And another thing that's come up over the last 18 to 24 months, and I'm sure we're all aware of it, is the cost of living crisis. What that means for people's access to healthcare and also getting things such as prescriptions. So those are other things that we've looked at in this last year. Finally, I would probably always have to and should do and want to talk about what we can do for self-care and prevention. As we all know, prevention is better than cure. And if we know things about our bodies earlier on in our lives, then we can do something about it. So, as I said last year, vaccinations are incredibly effective against infectious diseases. So please go and get any vaccinations that you're due that are coming up in this following year. And the other thing to think about is cardiovascular disease. And again, one of the biggest killers, or the biggest killer in our area, is cardiovascular disease. And what we can do about that is thinking about exercise, stopping smoking, and knowing our numbers. And what I mean by knowing your numbers is what's your cholesterol, what's your blood pressure, And now we can do blood pressure checks at lots of areas across our patch, including pharmacies. And in the future, optometrists will be able to help us there as well. But if you get called for anything to do with that, please go and get your numbers checked. And if you've got access to a monitor at home or somebody else's monitor, please do check your blood pressure. Because if we can prevent you getting heart attacks or strokes in the future, then that's much better for you and your family and your community. And finally, personally, I would like to add a few reflections myself. One of the things that I've seen in our practice is how people are embracing technology to get in touch with us. And we're really pleased that our region in Humber and North Yorkshire is the biggest user of the NHS app across the country. And that is amazing. And what you'll see coming up over the next few years is how the NHS app becomes the first contact or the main portal into our services. And that's not to mean that there are other means that you can do things by, but if we can channel as much as we can through our digital and innovation and technology, then we'll be able to free up other areas for people who maybe can't access it like that. So finally, I'd just like to say thank you for the public support over the last year. I know it's been hard and there's been some struggles that we've been through, especially through industrial action, and unfortunately some bits of that are continuing. But we have come out stronger, we have learned lots of lessons, and we want to push forward with all of these areas over the next few years.
Hello, my name is Jane Hazelgrave and I'm the Executive Director of Finance for the ICB. For the financial year ended 31st of March 2024, it was the first time the ICB had operated for a full financial year. It has been a challenging year with high inflation, near zero real terms growth and service disruption due to industrial action. Despite these challenges, the ICB has delivered all its core financial targets and supported its system partners deliver on their financial plans. For the financial year to the end of March, the ICB received income of just over £4 billion and delivered a very small surplus of £300,000. In terms of other financial targets, the ICB has delivered a break-even plan, it has delivered its savings plan, operated within its overall funding allocation, operated within its cash limit and capital funding allocation, operated within its running cost allocation, and achieved the minimum mental health investment standard, which is still subject to audit and review. In addition to that, we expect to receive unqualified audit opinion and also achieve a value for money opinion through the audit process. In terms of where we spend our money, just over 51% of our funding is spent on the acute sector, which is just over £2 billion. In addition to that, we spend around 10% of our budget in primary medical services at £432 million, mental health services £391 million, community services £358 million, and prescribing £350 million. Thank you for listening.
That concludes our annual general meeting for Humber and North Yorkshire Integrated Care Board for the year 23-24. Thank you so much for listening and watching our annual general meeting. Engaging with the public is such an important part of what we do, and I'm grateful to you for giving up your time. Please don't hesitate to follow up on the things that you've learnt and heard today by going to our website. Thank you again and good afternoon.